Leflunomide is commonly used for the treatment of autoimmune diseases such as rheumatoid arthritis, RA, and psoriatic arthritis, including in patients over 60 years old. However, its use in older adults requires special consideration due to age related physiological changes, comorbidities, and polypharmacy. Below are key points regarding its safety in this age group. Common adverse effects: hepatotoxicity. Older adults may be at higher risk due to potential pre existing liver disease or concurrent use of hepatotoxic drugs, e.g., methotrexate. Monitor liver enzymes, ALT, AST, regularly, particularly in the first 6 months. Gastrointestinal issues, nausea, diarrhea, and weight loss may occur, but are generally tolerable. Hypertension. Leflunomide can cause or exacerbate hypertension, which is prevalent in older patients. Monitor blood pressure regularly. Ha2, immunosuppression and infection risk. Older patients have a naturally reduced immune response, immunosenescence, and are more susceptible to infections. Leflunomide may further increase this risk. Regular monitoring for infections, particularly respiratory and urinary tract infections, is recommended. Ha3, bone marrow suppression. Leflunomide can cause cytopenias, e.g., anemia, leukopenia, thrombocytopenia. Regular complete blood counts, CBC, are necessary. 4. Drug elimination and metabolism. Leflunomide has a long half-life, and older adults may have reduced renal or hepatic clearance, increasing drug exposure. Dose adjustments are usually not required but should be considered in frail or multimorbid patients. Pregnancy considerations. Not specific to older adults, but important for postmenopausal women, leflunomide is contraindicated in pregnancy. 6. Polypharmacy concerns. Older patients often take multiple medications, increasing the risk of drug interactions. For example, leflunomide may interact with warfarin, leading to an increased risk of bleeding. 7. Monitoring recommendations. To ensure safety in patients over 60, regular monitoring is essential. Baseline tests, liver function tests, CBC, and creatinine. Follow-up tests, every 4 to 8 weeks initially, then less frequently if stable. Screening for infections. Evaluate for latent tuberculosis (TB) and viral hepatitis before starting therapy. 8. Considerations for dose. The standard dose, 20 mg a day, may be well tolerated in many older patients. If side effects occur, reducing the dose to 10 mg per day can be effective while minimizing adverse effects. Conclusion: leflunomide can be safely used in patients over 60 years, provided there is careful monitoring and consideration of individual patient factors, such as liver and renal function, infection risk, and concomitant medications. Close collaboration between rheumatologists, primary care providers, and potentially pharmacists is essential for optimizing therapy in this age group.